absolutely think that trusting your instinct is so important. If you feel like something's not right, even if you've been told everything is okay, keep searching because there is a huge gap in knowledge. Tongue ties and lip ties are not just a breastfeeding issue. There are issues that can show up later in life. It could be something that's a dental issue, an airway issue, difficulty even eating solids.
Hey, Amy, thank you so much for agreeing to do this video with us. If you would like to introduce yourself a little bit and talk about your platform and your road to becoming a lactation consultant, that would be great. And then we'll jump into all the tongue tie information.
Yes, thank you so much for having me. My name is Amy Fields, and I'm a registered nurse, and I am also a board certified lactation consultant, or an IBCLC is what we're called. And I started out 23 years ago as a labor and delivery nurse. And I did that for almost 18 years total. I worked mostly in the hospital, but I did work for 2 years in a freestanding birth center, and I did assist with some home births. So I got to see births in a lot of different ways. I became an IBCLC in 2012. So there was some overlap. I worked as a nurse, as a labor nurse while I was an IBCLC, and when I was at the freestanding birth center, I was able to work as a lactation consultant in the community and found that that's truly what I really loved. And so I've been doing that since 2014 and started my own business. I live in the suburbs of Phoenix, Arizona, and I do home visits all over the valley. I also have an office where I live in Goodyear, and then I have another office in Phoenix. I now have 6 other RN IBCLCs that work with me and that do consults as well. And I have an Instagram account. It's AZ Breastfed Babies. That's the name of my company. It started as AZ Breastfed Babies because I'm in Arizona, but I have people that are like, that's perfect. It's like A to Z. So either way, whatever works.
Oh, I never thought of it that way. That makes a lot of sense too.
Yeah. So Instagram has been really great. I've had a lot of fun doing it, and it's a great educational platform, and I'm able to reach a lot of people and, answer questions. And then for the people that need more one-on-one help, we can help them virtually or in person.
Able to do a couple of virtual visits with Rosie, which were really helpful. Amy gave me some tips and techniques to kind of help retrain her tongue, which we're still working on, but we're work in progress, which is kind of how tongue ties tend to be. And we'll get more into that as well. But when we're talking about tongue ties, I don't know if it would be helpful if you first kind of explained what the function of the tongue is with breastfeeding, what the lips and stuff are supposed to do, so that we can kind of talk about what the variations from that normal are.
So when we are looking at the function of the tongue when it comes to breastfeeding, that is very unique. With a baby, the oral function breastfeeding at the breast versus a bottle is going to be very different. And then as the child gets older, we get into eating solids, drinking from a cup, speech, all of those things. And specifically with babies, and when we are talking about the function of the tongue, so I have my little mouth right here, we want the tongue to be able to extend or stick out, like when the baby is licking or sticking their tongue out, extend past the lips. So that's one thing that we assess for. Sometimes babies that are tongue-tied can stick their tongue out. There can be extension. But a lot of times you'll see their tongue come out and down and not straight out. So that's one thing that I watch for. We also want the tongue to be able to move laterally. So when we do an assessment, I actually put my finger in the baby's mouth. I have a glove on, obviously, and massage the gums like I'm brushing their teeth, and I'm watching to see, does their tongue easily move from side to side, or is it trying to tip or curl or anything like that? And then we also want to see if the tongue can elevate or lift up. So when a baby is crying too, that's something that we can actually visualize when they're crying. And then we have the baby suck on our finger. And when we are having the baby suck on our finger, we are assessing the shape of the roof of the mouth or the palate, and we're feeling the undulation of the tongue. Is the tongue doing this wave-like motion from the back of the tongue all the way to the tip of the tongue, or are we only feeling movement in the tip of the tongue, the anterior portion? Are we feeling that the tongue is cupping around the finger and doing that undulation? Are we feeling this like chompy motion back and forth? Are we feeling like a lapping motion? What is happening with the tongue? When I have a client and they say that the pediatrician looked and said there was no tongue tie, and then I do my assessment, sometimes they're like, yeah, the pediatrician didn't do that. They just kind of looked. So one important thing to remember is that when we are doing an assessment for this, we need to look, listen, and feel. So we need to look, which includes watching a feed. We need to listen. Do we hear clicking and slurping? And also, that extends to listening to the mother to have her tell us what it is that she's feeling. And then we need to feel. We need to get in the mouth and feel around and see what that tongue is actually doing.
I feel like a lot of people, their experience is, oh, like something's not going right with feeding, and the pediatrician will look right in the mouth and say, well, it looks normal, but it sounds like there's a lot more to look at, and it's more about the function too than what it looks like, which
Yes.
is important, right? Because you have to function to exchange milk and to have a milk supply and to feed your baby, which are all things that can be compromised by a tongue tie.
Yeah, so that is why we cannot diagnose via just a photo. So everybody has frenulum in their mouth. We all have them. We have frenulum under our top lip, under our tongue. We have these side ones that are called buccal fibers or buccal frenula. And so it's not just that we have them, it's how are they functioning? Are they restricted? And that's all really important to know. So we can lift up 100 babies' lips and look, and they're all going to have frenulum. And so it's the assessment that really matters. Like, is there blanching that happens? Does it blanch and turn white because of the tension when we lift up the lip? Can we even lift up the lip? There's some babies, I can't even lift it up. It's so tight.
Talked a little bit about what things you might see looking for function. Are there specific symptoms that the mom or the baby might be experiencing that kind of give us a clue that we might need to look for a tongue tie?
Definitely, and that can vary. That's what makes this kind of like a little bit more complicated, because I actually did some posts on my Instagram about the different presentations of oral restrictions of tongue ties and lip ties. And for some babies, it's easy peasy. Like, the symptoms are super obvious. As a newborn, the baby may not be gaining weight well. Mom has so much pain with breastfeeding that she can't even get past that first couple of days or the first week. The nipples are cracked and bleeding. Like, those are the big red flags. So we know that we cannot move forward without addressing what the issues are. And then we have those babies that can get through, because remember, some babies can actually breastfeed with oral ties. So there are compensations that can happen, and those compensations could include anything from, mom pumping in the very beginning and bottle feeding and then kind of transitioning to the breast, using a nipple shield, or I've seen moms just breastfeed with cracked, bleeding nipples and they just keep going. And I don't know how they do that, and so sometimes we get through some of the struggles in the very beginning. And then especially if, mom has a really robust milk supply, she just has a lot of milk, then we have that baby that just doesn't even really truly need to latch onto the breast. They're just putting their mouth on the breast and just guzzling the milk that's flowing to them. They're living on the letdowns. So they don't have to work very much. And what happens for some of those babies is that when we get closer to the 8 to 12 week postpartum mark, when the breast milk down regulates, which is a normal thing that happens, then those babies don't have that milk that's flowing at them like it was, and then the problems start. And so a lot of times those babies, because they don't really have a good latch and they're just guzzling all this milk flowing at them, they tend to be farty, gassy, they're swallowing so much air. Sometimes they'll get diagnosed as having reflux because they are so gassy and spit up so much, and they're just uncomfortable and they're just grunty. And oh my gosh, usually they're gaining weight pretty well. So then everybody is like, oh, the baby's gaining weight, you're fine. Like that's the only thing that matters. And meanwhile, moms are like, yeah, they're gaining weight really well, but they're so grunty and they seem so uncomfortable. And like a mom's instinct is usually right on. She's like, something's not right. Sometimes the pain starts around that 8 or 12 week mark, and then they're like, why is it starting to hurt now? And I will tell you, so often moms feel like they're doing something wrong, and that's not the case. And then there's the sneaky ones that nobody really catches, or we're like, is this really something that needs to be addressed? And then you get through breastfeeding for a certain amount of time until like maybe, the teeth come in, or, the baby just doesn't want to use their compensations as much, and they start to figure out that bottle feeding is a lot easier than breastfeeding, and so they get really fussy at the breast. Those babies are the ones that will often breastfeed better when they're sleepy, or the feeds in the middle of the night go well, but the ones during the day don't go so well. So you can see that there's like different presentations and different struggles that can happen. So it's not like we can have this checklist and like, if this, and this is happening, it's always this. Like the human body is so unique. And as labor nurses, we see this with labor, right? So
Totally.
It's the same thing with breastfeeding. And even for one woman and how she gives birth to each of her different children, and people are outside of the box, so to speak. So it definitely is like this in the lactation world, and especially with tongue ties and lip ties. So anyone that tries to tell you like, oh, it's easy, it's not. And I'm constantly learning, I'm constantly taking classes and trainings, and really trying to have this community and network of other professionals. Especially you'll see that on Instagram, because I know that I don't know everything, and I know that I'm constantly learning and I'm constantly challenged. So yeah, definitely have grace. And I know this is one of the things we wanted to talk about, like, how do you find a professional that is specially trained in
Yes,
this?
because they all are not.
Right.
And even lactation consultants, I think sometimes a lot of the ones that work in the hospital are really good at noticing those super obvious, the tongue is heart-shaped, there's an anterior tongue tie right in the front, but those posterior tongue ties, which are the ones that are further back that you talked about, that are a little bit more insidious, like the lactation consultants in the hospital might not be as well versed in recognizing those, or it doesn't become an issue until your milk comes in and you're not in the hospital anymore.
Yes. And because I was a labor nurse, and because that's the pathway that I took to become an IBCLC, I can speak to this. But we really have a very, very narrow training or experience. And it is really only babies in those first few days. So that's something to remember. A lactation consultant or nurse can become an IBCLC without ever having worked with a baby past 3 or 4 days old, or never having worked with a baby out in the community. That is possible. And so the lactation consultants in the hospital, they are skilled, and it's important to have them there. Their training is really good for what they're working with for babies in the hospital. Sometimes they have gag orders and they can't talk about tongue ties and lip ties. So, definitely it's not anything that we should be like angry with them about if they don't find a tongue tie. And here's the other thing. I don't necessarily think all babies should be assessed right after birth, because we have a brand new baby that was in the fetal position in utero, and there's just naturally a lot of tension that happens in their neck and their jaw when they're curled up. And sometimes that tension is what is restricting the movement of the tongue. And it's when we get home and we start, laying the baby on their back, or doing skin to skin, basically in like tummy time with them on our chest, that they're able to start moving around. And that's why a lot of us are like, we need to limit the amount of time they're in a swing or a seat or anything, because it curls them back up. We really want them to start to open up. And so sometimes that's why with some babies, that's how their latch gets better over the course of a couple of days. That is possible. So it's, something that we should take note of, that the lactation consultants in the hospital don't necessarily have to be trained in doing this. And that's the truth of it. It really is something that is lacking as far as community support once you get home from the hospital. Lactation consultants in the community absolutely need to be constantly updating their education. And if they're not, and they're not educated in it, then I think that's a problem.
Something else kind of you already spoke on, where we're talking about like the pediatricians aren't maybe as well versed in lip and tongue ties, which pediatricians are versed in like so much that it would be hard for them to really specialize in that. So you need other people who have specialized in that, like lactation consultants. But then there's also other people that perhaps need to be on your team when you're doing lip and tongue tie releases, because just simply releasing it is not enough for most people to see a significant improvement in breastfeeding.
And there is another article that Michelle Chatham, so she kind of used this analogy of an iceberg, and how there's icebergs in the ocean where we see the ice on top of the water, but then there's also the berg under the water, and it could be small or it could be really big, what's under the water. And then there's the ice flows, where it's literally just the ice floating on the water and there's nothing underneath. With oral ties with babies, there are some babies that it's just the tongue or just the lip that's restricted, and they get it released and off they go. Everything is better. Moms report that breastfeeding feels better and different right away. And the first week might be a little bit rough just because a procedure was done and the baby may be sore, but there's not a whole lot that needs to be addressed or done, right? Breastfeeding gets better. Then there are those babies like Rosie, where it's a tetherberg and it's an iceberg. There's a lot under the surface. And it could be, things like a high palate, which can affect their latch, and that takes time to address. It could be that there's tension throughout the body that needs to be addressed. It could be even things like food allergies that need to be addressed to help breastfeeding get better. So there are other issues. And so these are the babies that they get released and breastfeeding doesn't necessarily get better right away. Maybe like body work isn't done. And when we say body work, that could be chiropractic, osteopathic doctors. It could be OTs and PTs do. So occupational therapists and physical therapists do body work as well. It could be cranial sacral therapy. And every baby responds a little differently to those therapies. So what works for one baby doesn't necessarily work for the other. So there are babies that even doing body work before the release could be very beneficial. The team approach is important. So having a IBCLC that's trained in all of this is important, because she may say, don't do the release quite yet. Let's do some body work first and address some of these other things. So then we'll figure out when would be a good time for the release to be done. It's almost like a triangle. You have the IBCLC, you have the release provider, and you have the body worker over here.
It's definitely a team effort for sure. And then I guess another thing is, when we're talking about a release, could you talk just a little bit about the different types of releases and how to pick your provider or how you would do the release?
So there are release providers that use scissors to release the frenulum, and sometimes pediatricians will do this in the office. That tends to be those tongue ties that are attached more either midway or to the tip of the tongue, where you can visually see that tissue, and they'll clip it. Sometimes that's not a complete release. It releases some of the tension, but not all. Sometimes there's enough relief that it does help at least some, like breastfeeding does get somewhat better, but often there needs to be a more complete release done. But I think it's a good start, but it's also important to note that that might not be the end of the story or what needs to be done. We have a couple of release providers that are ENTs here in the Valley that do complete releases with scissors. So how to know the difference between an incomplete and a complete release is that when it's a complete release, you're going to see a diamond under the tongue. It will be white, so it's going to be a wound, and it will look like this. So when you lift up the tongue, you should see this diamond. And then there are providers that use lasers. And there are different types of lasers, and there's even providers that use something called an electrocautery, which I don't really recommend because it's very damaging to the tissue. And when we have a baby, a breastfed baby, we don't want them to miss a meal. If it's an older child or an adult, they can have popsicles for a day or so and they're going to be just fine. But for a baby, we want them to be able to eat right after the procedure and to not miss a feed. So some of the lasers that have come out in the last couple of years, actually, like the providers that I refer to here use CO2 lasers, what they call a cold laser. So there's not as much tissue damage, and it has a cautery effect. So there's usually less bleeding, and there's still swelling that happens. So for 24 to 48 hours, it might be a little more difficult to get the baby to latch, but we should not have any babies that aren't latching. But that's why it's good to have somebody on your team that knows what's in your area. When we do virtual visits, we usually reach out. We have a network that I have a network that I utilize where I find out like who's in Minneapolis, who's in Florida, who's in these different places that are doing releases and doing body works.
From what I have heard, and this is kind of what you're verbalizing as well, it doesn't matter necessarily the type of release, whether it's the laser, the cold laser, or the scissors, but the skill of the provider. And what you're going to have is either pediatricians, some of them are skilled, or an ENT who's skilled, or a pediatric dentist who's skilled in releasing tongue ties.
Yes, definitely. So every community is going to have different professionals. So it is the skill, not the tool. Dr. Kahari in Portland has an amazing website and blog where he actually talks about this. And he just released a study where they used a bottle that had some type of mechanics on it that measured the baby's sucking abilities pre-frenectomy and then post-frenectomy. So that study just came out and it's actually really cool. So I'll send you the link for that so you can list it. But it is definitely the provider and not the tool. There's some trainings that, do you want me to list the trainings that that I think are important?
Yeah, I think that could be helpful.
I will just say that when I first became an IBCLC, I did all the training. It took me about 2 years to get all of my hours to sit for the boards. And then I started working in the community, and about a year after I became an IBCLC, Dr. Agarwal, who is a pediatrician here in Phoenix, and actually is well known in the tongue tie world, said to me that I should go to a conference that was happening in June of 2013 in Florida, and it was all about tongue ties. And when he told me it was a 4-day-long conference, I laughed because I could not imagine what they were going to talk about for 4 days about tongue ties. But I knew that there was obviously something I was missing and I needed to learn. So I went and was absolutely mind blown. It was a 4-day conference and it was about tongue ties over a lifespan. So it wasn't only focused on babies. It was talking about oral restrictions and how it can affect people throughout the whole lifespan. So children, adults, and they had people from different professions. So there were dentists, speech language pathologists, physical therapists, occupational therapists, and there was probably 300 people at the conference, and there were only 2 pediatricians at this conference. One of them was actually Dr. Agarwal. And there were a lot of IBCLCs, lots of us. And so I went to this training, was absolutely mind blown. As I'm sitting there in these different sessions, I'm having consults that I had done, just going through my head and realizing that I had missed tongue ties in some of my clients' babies. And so when I got back, I called about 6 families back into my office and said, I think I missed something and I want to reassess your baby. And they were all really nice about it and grateful. And so actually sent them on to Dr. Agarwal's office. And, those babies did have tongue ties. The tongue ties were released and breastfeeding got better. And yeah, so that was one thing that I did. And then in the years since then, I've done the Master IBCLC class, which I highly recommend. It's actually online right now. So anyone that is an IBCLC can look that up. And I'm sure you can put like a link too for that.
Yeah, I'll link all of the resources that you give me for this for sure.
Okay. And then there's another course that I just took this last spring, and it's the TOTS class that Autumn Henning at Crystallis Oral Facial put on, and she does do them in person. She does have quite a wait list for that, and so she has put that class online as well. So those are just a couple classes that I think would be really good for lactation consultants. And then Autumn's class, chiropractors, dentists, OTs, PTs, people of different professions can actually take that course. So I think that is really, really great. And then I have a project that I'm working on with 2 other IBCLCs, Kelly Upirno and Sarah Lang. So we are releasing, and we have the parent education portion of it up and going. And we actually, in early 2022, will have the professional part of it going, which is Level Up Lactation. And so we are actually going to have training, and it's going to be all the way for people that work as birth professionals. So doulas, anyone that works with new parents, all the way up to IBCLCs. There'll be specific training for that. So that is something that we're excited about and working on. So stay tuned.
That is super exciting. I'm excited to take that. Okay. So I guess the final thing that we wanted to talk about is, what should you do if you, as the parent, as the person who's breastfeeding, suspects that there is a tie? What are the steps that you should take?
I absolutely think that trusting your instinct is so important. If you feel like something's not right, even if you've been told everything is okay, keep searching, because there is a huge gap in knowledge with professionals as far as oral ties go. Instagram is actually really a great resource. So I would probably say reach out. We always try to find someone close to you. Like if you can see someone in person, that's going to be ideal. So reach out to me, reach out to Autumn Henning of Crystallis Oral Facial. We can definitely help find somebody that is knowledgeable and has training and can help you work through this. You're not crazy. You're not, seeing things or feeling things that aren't real. This is not a mom problem. This is definitely, the puzzle pieces aren't fitting together because of those oral ties. So if you suspect that there's something wrong, finding a lactation consultant and IBCLC that has that specialized training is important, because we have parents that are, seeing the IBCLC in the hospital, maybe seeing the IBCLC once they're discharged in an outpatient setting and being told that everything's okay. Maybe they paid for an IBCLC to come to their home and work with them, and things still aren't getting better. Their pediatrician tells them everything's okay. Maybe they were told some babies just can't breastfeed. Some moms just can't breastfeed, and that's not true. That's unfortunate. Sometimes you have to just keep searching for the right person to help you. And it may not be anyone in your community, unfortunately. It's getting better. It's better than it was. I've been doing this for almost 10 years. And we are definitely seeing better and better resources across the United States and across the world. So hang in there, and just know that however you feed your baby, you're an amazing mother. So if breastfeeding doesn't work out for you, or even if it's something that you just didn't really want to do, that's totally okay. If you're an exclusively pumping mom, that right there is amazing. Those are super women for sure. if you have low milk supply, every drop of breast milk counts. It's beneficial. It has antibodies in it. Have grace with yourself and don't feel guilty if this was something that you think maybe was going on with your baby and it was months ago and you're already past that point of in your breastfeeding journey or pumping journey or whatever the case may be. But if you're right in the heat of the moment and you're still struggling through it, reach out. The other thing is tongue ties and lip ties are not just a breastfeeding issue. There are issues that can show up later in life. It could be something that's a dental issue, an airway issue, difficulty even eating solids. So if there's something going on like that, Autumn would be the right person to reach out to. There's actually a couple of really great Instagram accounts. Hallie Bolkin has a great Instagram account. She has a podcast called the Untethered Podcast that I highly recommend. And then there's a mom, I think her name is pronounced, I think it's Mary, it could be Mari, that is the Unbound Network. And her Instagram is all about her journey with her baby through oral ties, through not being diagnosed initially, through all of the struggles that we see that moms have. So you're definitely not alone. Another account that I really like for like baby movement and physical therapy and tummy time and things that you can do at home is Dr. Giselle has Milk Matters PT. And I really, really love that account for parents. I send that to parents all of the time because it talks about how the tip of the tongue is attached to the toes. So through the dura and that tension that can go all the way through from the tip of the tongue, swallowing, airway, all the way through the diaphragm and respirations, digestion, pooping. That's something that we see too, babies having a hard time with pooping when they have those restrictions. So we don't want to just address the exercises and the tension in the mouth of the tongue. And I know I've talked about this to you a lot with Rosie, is we want to get the whole body moving. We want to use rhythmic movements. We want baby to spend time on the floor, not sitting in a seat as much as possible. There's times when we have to put our baby in a bouncy seat. I'm not saying don't ever put your baby in a bouncy seat, but as much as you can on a flat surface, having them do tummy time, spend time on their sides, like put them on their side, especially if they have one side that's a little bit restricted, they're not moving as much. You can put a mirror and toys in front of them and get them like really starting to move that. And that's important because we don't want to just focus on body work that's being done at the chiropractor's office or the physical therapist's office. It's also the stuff that we're doing at home and that's really good for babies.
Percent real life, because she was supposed to be taking a nap right now, but she had other plans.
Yep.
Are there any last little nuggets of wisdom that you'd like to leave any of our viewers with? We're going to leave so many links down below for everything that you've talked about, which have been so useful and helpful. But anything else you'd like to share?
Let me think. What words of wisdom do I have? It's so important to not compare ourselves to other people and to embrace our journey and to reach out for help whenever we need it, because we really aren't meant to do this alone. And this last year and a half with COVID has been especially difficult. A lot of parents feel very isolated. So in whatever way you can, try to reach out, even if your bubble only includes one or two other mothers that you can get together with outside and, be real with. That is so important. Find somebody that you can be real with.
Yes, that is so, so important, especially right now with COVID and the isolation that a lot of people are experiencing. It is so important to have a group of people that you can rely on and text at 3 a.m. and be like, I need help. I need somebody to bring me coffee tomorrow. It's been a miserable night or whatever. So
whose idea was it to have this baby? Like, I love this baby. I love this baby, but oh my gosh, I just want to sleep so badly. And I think especially because of COVID and, the lack of availability for classes right now, there used to be classes that you could go to. That is part of the reason why we have created Baby Prep University, is because parents have questions. And so that is going to include the core classes, which is the breastfeeding, the pumping back to work, which will include like bottle introduction or help for families when they have a baby that's refusing a bottle, starting solids, even weaning. And then there's going to be these bonus modules that are going to be everything from like how to wear your baby, how to burp your baby, infant massage, like all of these little bonus things. And then there's also going to be a monthly community meeting, like a Q&A. So we're hoping that that fills the need or the gap that we have right now with, parents having resources.
Well, thank you so much for doing this video with us. Sorry for our little intrusive friend
It
who could
doesn't
not
matter at
chill.
all.
Well, and then Rosie started screaming, and we couldn't film an outro, which is the most hashtag mom life thing I've ever experienced. But I just wanted to say thanks again to Amy, and make sure you check the description of this video for all helpful links that you might need.